I thought I would take some time today to talk about capacity to serve. And I think it's an important time to be doing a little bit of reflection. So 2021, it's been another year for the record books. The effects of the pandemic and the recession have had such a deep impact on individuals and organizations. Some reflection is called for as we move cautiously forward in the senior sector. I want to spend a few minutes just reviewing some survey results of this sector conducted by Healthy Aging Alberta last fall. And then I thought it might be interesting to look at one example of a mid-sized senior center and the older adults that it serves here close to home. I'll close with a look at the road to recovery. Healthy Aging Alberta surveyed sector members from late October to the end of November last year to better understand the issues organizations were experiencing in providing services and programs to older adults during the pandemic. Of the 106 responses to the survey from across Alberta, 27 responses were from Edmonton organizations. The most significant concern that related to organizations was the ability to raise and maintain funding. 36 reported a decrease in the ability to provide services over the past 12 months. Organizations responding to the survey reported that every source of funding decreased by at least 18% in federal government funding, with the most significant decreases seen from earned revenue, which was a 65% decrease, individual donations, 51% decrease, corporations, a 48% decrease, foundation funding decreased by about 44% according to respondents, and provincial and local government funds decreased by about 20%. With the funding decrease, that creates a challenge for organizations to provide services. This included complying with or enforcing public health measures, organizational changes, staff mental health and wellness, staffing hours reduced temporarily or sometimes permanently, and difficulty recruiting and retaining volunteers. Cost increases concerned organizations as well. Opening and closing during the pandemic impacted services, and many organizations moved some programs online. Survey respondents also cited a wide range of impacts on older adults and their access to supports, in some cases due to fear of exposure to the virus or hesitancy in going online for assistance. Even as restrictions eased, numbers were not back up to what they were prior to the pandemic. Some organizations reported seeing a higher complexity of the needs of seniors seeking support. Examples experienced by organizations include an onset or a return of mental health issues associated with increased isolation and a noticeable decline in the physical health of seniors. I want to share one statement from the report. The increasing complexity of client needs combined with the growing demand for service and a minimal increase or decline in organizational capacity raises real concerns about the ability of community-based senior serving sector to meet the demand for services in the communities. Most organizations were, however, hopeful that as our province recovers from the pandemic, their organizations and the older adults they serve would also recover. Let's look at one organization here in Edmonton to help bring these results to life, although I expect many people here today already know all too well the impacts of the last few years. From 1999 to 2006, I worked for the Calder Seniors Drop-In Society, which is now known as the Northwest Edmonton Seniors Society. I asked their current executive director if she'd mind if I used the organization as an example, and she was kind enough to provide information. These are photos of the center, and it's located on 120th Street and 129th Avenue. It's close to the CN rail yards and just north of Yellowhead Trail. And while the society was established in 1975, that's the original building up on the top right, the picture. It didn't open until 1979, and the bottom right photo is the commercial kitchen and gymnasium, which were added to the center several years ago. Audited financials from Northwest Edmonton Senior Society from the year 2018 to last year were reviewed to see how this organization has weathered the storm. As you can see, there's been a drop in revenue. Taking the 2018 total revenue compared to 2021, there's been a decrease of about 43%. Between 2018 and 2021, revenue dropped in the following areas. Municipal grants went down by 43%, casino funding was down by 39%, program revenue down by 63%, membership sales went down by 64%, and revenue from rentals went down by 41%. With the decreases in revenue, expenses had to be reduced, and as you can see, salaries was the biggest cut, and that involved the loss of some positions. They also cut back on janitorial services when the center was temporarily closed. Office and admin, repairs, and program expenses all decreased over the time period. They serve as one of the 6 district agencies and completed 18% of all the intakes to the Seniors Home Supports Program in 2021, which translates to helping about 300 older adults to access service providers for snow removal, yard help, minor home repair, housekeeping, personal care, and moving assistance. They do this with the help of a part-time home support coordinator, which works about 25 hours a week, and that's funded by FCSS. The older adults that access the program are not necessarily members of the center because you don't have to be to use the program. The center has a number of programs, including pickleball, fitness classes, drama club, card games, craft groups, a tax clinic, and for decades, they were home to the Calder Cuties singing group. Their jam session often attracts people from all over the city, and the gym fills up with dancers who come to enjoy the jam. Their tagline is "Where Friends Meet" on 120 Street. The average age of members has increased over the years, which is something that many other senior centers have experienced. The number of members has decreased from 428 members in 2018 to 283 last year, which was a tough year for stops and starts at the center. This year so far, they have 338 members, so people are starting to come back to programs. Northwest Edmonton Senior Society is not unique in the challenges they've had to weather. And with the current funding models, there's such risk that centers like this one may not make it. I want to loop back to the capacity survey from Healthy Aging Alberta for a moment. One respondent put it succinctly by saying the loss of earned revenue, lack of casino funds, and decreased government subsidies could break our organization before we have the chance to recover. Yet the population age 75 plus is projected to grow at a faster rate than any other age group in Alberta, so we need to maintain services, especially given the fact that the majority of older adults want to remain living in their homes as opposed to moving to care facilities. Having worked at the Senior Center for 7 years, I know firsthand the power of community-based programs. Participants form lasting friendships, they have fun, they look out for each other, and having a social support network more than anything is so critical in addressing social isolation. It's difficult to articulate the impact of the senior serving sector on the well-being of older adults that volunteer, take classes, participate in programs, or access services through community-based senior serving organizations. Articulating the impact of the sector is a strategic objective of the Healthy Aging Alberta, and there's now an opportunity to use a tool developed provincially. It's called the Healthy Aging Framework. I would encourage everyone to take an opportunity to learn how to use this resource. We need new funding models to support organizations like Northwest Edmonton Senior Society, but we need to be able to make the case for an investment. Dr. Richard Lewanchuk is the Senior Medical Director of Health System Integration for Alberta Health Services. In 2018, he was author of an abstract that was included in the International Journal of Integrated Care about the critical importance of going beyond administrative data for health systems planning and integration. The databases of the provincial government and its healthcare delivery arm, Alberta Health Services, were analyzed to determine whether administrative data would provide sufficient information to show how costs in the healthcare system can be reduced. Administration data included all encounters with the healthcare system, such as physician visits, hospitalizations, emergency room visits, and diagnostic testing. The data identified the frail elderly and medically complex elderly as the major demographics driving healthcare costs. When they explored root causes for healthcare utilization and costs, both by interviews and by adding in social data, they found that social factors were huge determinants in predictors of healthcare costs and utilization. For example, loneliness scores in a large sample of seniors correlated with future healthcare utilization and costs. The data pointed to the need for strengthening primary care and enhancing social supports in the community. The graphic here is from the Canadian Frailty Network, and they say that in community settings, frailty predicts future hospitalization, worsened quality of life, and loss of ability to carry out activities of daily living. Routinely identifying frailty offers opportunities for targeted care, including applying clinically practiced guidelines and tools specific for frailty. All senior centers and service providers like Drive Happiness, like Meals on Wheels, all our cultural organizations that provide programs and support to older adults like the Shama Center, they are worth their weight in gold. Ideally, there would be robust and coordinated investment in the sector all over the province, which is another of the strategic objectives of Healthy Aging Alberta. We've heard from Dr. Candy Khan today about addressing systemic barriers to inclusion, and funders want to know how organizations are embedding equity, diversity, inclusion, and belonging into their staffing, their boards, their service design, and delivery. Organizations that embrace this work are going to have an easier time recovering and accessing funds. And I would encourage all organizations to access training for boards and staff and to use this knowledge to look at policies, processes, programs, etc. And I think we'll have to have Dr. Khan come back and do some workshops for our sector. ESCC's work to foster collaboration and coordination continues, and this aligns with Healthy Aging Alberta. And as a member of their Community Leadership Council, I look for ways that the Edmonton Seniors Coordinating Council can be supportive, because it's going to take all of us pulling in the same direction to be able to ensure that services for older adults are better resourced and they're inclusive. ESCC will continue to support interagency conversations to generate strategies for resource sharing and attracting more of an investment to senior services here in Edmonton, and aligning efforts where it makes sense to do so. Thank you to all of our member organizations, your staff and board, and to our funders who see the value in coordination. And thank you to Northwest Edmonton Senior Society for letting me use you as an example today. I also would like to thank our board and our staff who care so much about this work. And here I thought I would just share with you the website for Healthy Aging Alberta, which is the corealberta.ca, and the capacity survey that I mentioned can be found on that website, but there is the link as well, and I'll put these in the chat. Thank you.